Unused medication can take up some room in your medicine cabinet.
Maggie Chu, a pharmacist at Texoma Medical Center, explains why you should get rid of it.
When was the last time that you looked at what's inside of your medication cabinet? Expired medications or those you don't use anymore have no place in your home. Medications may get into the wrong hands or can be misused. Expired drugs may be less effective or even harmful if they are taken. Many people who misuse prescription drugs, especially painkillers, get them from medicine cabinets of family and friends. According to the 2018 National Survey on Drug Use and Health, 9.9 million Americans misuse controlled prescription drugs, and many of the drugs were obtained in this way. Here are some tips for cleaning out your cabinet. Check expiration dates on all over-the-counter and prescription medications. Expired products lose effectiveness and should be discarded. 2. Toss products that aren't sealed properly. Exposure to air, moisture, and heat may have altered the effectiveness or made the products dangerous to use. And 3. Get rid of all medications you no longer need, even if they haven't expired. 4. Some medications may be flushed down the toilet, but check first with your local community and the drug label to see if it is safe to do so. And remember, never share your prescription drugs with someone else. Your prescription may be harmful to other people, and they should visit their own doctor if they need medication.